Good afternoon, Mr. Priest. Good afternoon. How are you? It is Tuesday, October 7th. This is the regularly scheduled meeting. It's actually the work session of the Pitkin County Commissioners. We are calling to order at 1 o'clock. Present, we have Patty Clapper, Greg Poshman, and on the interweb through the Zoom workplace, we have Kelly McNicholas Curry. Francis Jacober is at the Mountain Towns 2030, hanging out with Bill McKibben today. It is 1 p.m. Our first item of business is Buttermilk Winter Parking Management Options. And from the manager's office, we have Brian Pettit.
Or Public Works, either
Public
one.
Works.
Yeah, but
Don't demote them.
More cooler tools.
don't make me drive into town. Don't make me drive into town.
Turning it over to Brian Pettit.
Thank you. Well, we've talked about this before. The last time we talked was in February, where the board decided to institute paid parking at Buttermilk for the summer. And we punted the idea of having paid parking in the winter for the staff and county manager to meet with the Aspen Skiing Company to try to resolve the issue of their concern about paid parking at Buttermilk. We met with the ski company 3 different times where we talked about different scenarios that could work in the winter there. While we didn't have full agreement on any particular scenario, we came up with 2 options to present the board today. One option is to institute paid parking at Buttermilk at $15 per space per day. That would generate enough revenue to pay for the cost of Buttermilk, of managing and maintaining the Buttermilk parking lot, and would likely give us enough money to provide an additional shuttle out of Brush Creek where parking would be free. So the idea is that shuttle would go by the airport, through Buttermilk, and back to Brush Creek to pick up more skiers. The other option was a free parking at Buttermilk, where we talked to the ski company about providing funds to offset what the county would make by having paid parking at Buttermilk. The ski company looked at that. They did provide an offer to give the county $200,000 to keep skiing free at Buttermilk, at least for the season.
Well,
Parking for free.
Parking. I said skiing.
Yeah, that's for the press in the room. Yeah.
Thank you. Thank you. I'll step back. So parking for free at Buttermilk. So that proposal has been submitted. That would not cover the full revenue loss that the county is proposing if it's paid parking at Buttermilk. The last thing I want to say, and this is not an attempt to get money out of skiers. This is an attempt to manage transportation demand beyond where the free parking is at the intercept lot. The whole idea of having the intercept lot, and it's called that because the idea was to intercept cars before they got into the entrance to Aspen. One of the primary reasons, and some people would say really the only effective way of managing transportation demand, is through paid parking. And that's the intention of having paid parking year-round at Buttermilk, is to provide pain for people driving beyond the intercept lot or driving to Buttermilk from the city of Aspen. And we can use that money then to provide more incentive to get people out of their cars by having direct shuttles. So that's the intention of Buttermilk. Of Buttermilk paid parking, always has been. The paid parking this summer has worked well. The county's revenue has been between $14,000 and $15,000 for the summer months. But there's just not the demand to park at Buttermilk in the summer. The demand there obviously is in the winter time, regardless of whether it's a ski day or one of the 4 special events that the ski company has at Buttermilk during the winter season. So I'm happy to answer any questions about these options or about the parking that went on this summer.
Commissioner Postman.
Well, yeah, comments, questions. Thank you for putting this forward. I'd love to understand a little bit more just on where the differences with ski company lie. I wonder, I guess RAFTA must be part of the conversation. Of course, we have a goal to electrify our mobility, and so I immediately jumped to, well, an electric bus from the Brush Creek lot to Buttermilk might be an ideal thing. Have we looked into that? So I have a lot of questions about it. I certainly like where it's going in terms of trying to meet the objectives of the pricing and parking models and disincentivizing driving all the way into town past the gridlock. So I appreciate that. I don't know if you have anything to add to on that. Just regarding where are we with SkiCo? There's a price difference, but do we have an opportunity to hear from them about what are the reservations, where are the red flags, when will we get a chance to do that?
So maybe I'll jump in and
Sure.
we can play, and please come on up, Jeff. Yeah. So right now there were really two options on the table. The option that came out through conversation is actually to maintain free parking at Buttermilk. And that would be managed through the parking provider, correct? And SkiCo has offered to make a payment to help offset those costs, a large majority, not all of those costs, but a majority of those costs, in order to basically keep things as they have been. There's none of the transportation demand management components that Brian was talking about. Staff had estimated that the revenues that would be collected from parking, and it would depend on rates and uptake and all those things, would be closer just north of $400,000. And the idea was to discourage parking, which Jeff, not to speak for you, but I think the concern was customer experience there. But to use those funds then to maybe run shuttles from the Brush Creek Intercept lot to Buttermilk and Highlands. That is not what's necessarily, those are two options. I think through our shared conversations right now, where we've gotten to is right now the preference I think would be for SkiCo to contribute to keeping the lot free in the winter, to be managed by our parking provider, and there would not be an additional transportation demand management component to that, so shuttle or such, right?
I get Jeff, and then I'll go back to Patty.
Yeah, and look, protocol-wise, I'm not uncertain,
No,
so if
you're
I'm
good.
doing something I shouldn't be, like, just tell me.
Thanks for joining.
Good to see you all, and Kelly, good to see you on the screen. I think John summarized it decently, and there's some nuance to it, and I would say my journey since I sat before you guys maybe, 4 months ago, has evolved a little bit as well through our meetings and other things. So SkiCo's position is that we definitely should be working together on a solution to incentivize intercept parking. And that solution and our request really with the offer that we've submitted to Brian and the team is to delay that so that we can do it the right way. And I think that's a little different than where I started. So just want to acknowledge that. I believe, and I've seen this happen, that parking decisions that happen when the leaves are changing colors in ski towns are not a productive thing for anyone. And there's lots of evidence out there. You can look at North Star, California, Eldora up above Boulder, Stowe, Vermont. All of them that did a late parking adjustment to paid, it has been difficult for the communities to handle. Mm-hmm. I recognize that our community has a lot of paid parking. Buttermilk has always, in the winter, at least in the minds of the people that use it, been free. It's a beginner ski area. It's where people learn to ski. And I think some of those elements are super important, and I maintain that we should respect that in our future planning. But to sit here in October and say without a PR plan, without a signage plan, without a communications plan, I think our community will suffer if we were to implement this winter. Thus, we are stepping forward and saying, let's help offset the county's commitment and work together on a plan that could include a more robust RAFTA presence in the plan, that could include high occupancy vehicle solutions in the plan, that could include potentially an identification of beginner skiers, people that are just starting, to try and make that easier for them. The magic chair is free. Not all skiing at Buttermilk, but the magic chair. I think we sit here before you, let's make a good plan and not do something that we're going to regret because we're not ready. And I'd say our commitment would be to, I think that there's need for a Highland Flyer type shuttle service. The one that we've been talking about is a 16-passenger shuttle that I don't think would handle the occupancy that we would offset by paid parking. So I think we would have some time with this offer of ours to sort through. Maybe it's an electrified option. Maybe it's a mix of that. Maybe I've heard the high school's interested. I've heard that the hospital's interested in a refined new route to Maroon Creek and I think in Highlands and so Buttermilk could be on that line and I think we could come up with a real elegant solution that benefits everybody down the line without handicapping it. I think that the sentiment of I don't have a real good confidence level that we've got it figured out, that we're going into November with a great plan where the community knows it's now going to be paid and others know that it's going to be paid. And, the HOAs on West Buttermilk and Tyhack feel like they're not going to get overflown with cars because of the solution and things like that.
So,
I
Jeff,
think I covered a lot of what I wanted to say, but yeah.
Thank you, Jeff. And I think Patty had a question, and then I'll go back to Jeff.
I just, as a clarification, thank you, was that the details, like the electric shuttles and the shuttle service, and don't forget Human Health Services could probably benefit from a shuttle too, by the hospital. But, I think for one, since it's been, I think I'm really impressed. Thank you guys for meeting and talking together, everybody who's been involved. Just to move this forward with the contribution from the ski company, but let's make sure everybody's got a lot going on over the winter, but let's make sure we have a plan that's thoroughly vetted with all the neighbors and all the impacted parties, positive and negative possibilities, and move it forward for the next ski season, not this ski season, next year.
And I do think there's opportunity for us to bring other partners to the table and think a little bit bigger picture about this. So appreciate the perspective.
And if
to buy
I
some
may,
time
I
and
think,
stuff.
let as a community, let's not do something that isn't well thought out. Let's do it the right way and make it better for folks. I don't feel like we're in the position to do that now. I think it is going to be critical as we go forward over the next couple of years with the airport, with all these other things that are happening, to have something dialed in and really a good experience for the people that are visiting our town and the people that live in our town.
Yep.
Yeah. Kelly, and then I'll recognize myself.
Thank you. Yeah, appreciate you all working through this. My questions are probably for Brian. So is there any penalty to us for reducing our contract with Metropolis to such an extent?
There is no penalty. In fact, just to correct some facts, is the ski company would take over managing the lot in the winter, which would reduce our contribution to Metropolis. However, Metropolis would do after-hours patrolling of the lot to ensure there's no camping and that kind of activity there. So,
Yeah,
just
and
to
that was a solution that we had kind of gotten to towards in our last meeting and part of the proposal. I think for now, it would alleviate some of the costs that you have and allow us to get to that solution, monitoring the lot in the daytime the way that we have in the past.
So to be clear, that we've contacted Metropolis and they're on board with either option.
Jill, did you have a
And
follow-up?
then I understand that this would result in lost revenue to us. Does it result in an added expense?
It's just really lost revenue on the balance sheet. That's what we're losing. It doesn't increase expenses.
Okay, thank you.
So for Jeff and Brian, is there any opportunity to do any service improvements in 25, 26? And I see Dave Peschenchek in the back as well. Any additional services we can offer skiers to reduce traffic beyond Brush Creek? So for example, is the service we're providing to Highlands today, I know this is a little bit out of scope, but is it ideal, and can we do anything in the 25, 26 session?
I might not be the best person to answer your question. I think part of the challenge for us is we run a shuttle between Buttermilk and Highlands.
Yeah.
That shuttle is not eligible for the bus lane. And so it really takes away the effectiveness of running the shuttle, because you're in with many times you're in with the traffic. And I would love a solution where we could start to think about these things that we're doing and to move people around between our, county-owned lots, privately owned lots, using RAFTA and the folks that want to help out. But obviously we want to, we have to follow the rules, and that existing shuttle can't go in the bus lane.
David, did you want to comment on that? David Peschenchek with RAFTA.
Yeah, Dave Pesnichek, Chief Operating Officer with RAFTA. To comment on being able to provide a service on RAFTA's end for 25, 26, we're finalizing our winter schedule now, so we're at the tail end of that. At this point, the nearest point where we could add additional service from a scheduling standpoint would be spring. I know there was some conversation about working with partners. We are having conversations with the high school, SKICO, the hospital, Pickens County, the city of Aspen, trying to figure out some sort of service between Brush Creek and up to the hospital and up to the Highlands and the high school. We're trying to put all the pieces together now, trying to identify what that funding might look like, but even with that, we're looking at spring. Even if it is some sort of limited type service, it would be spring at the earliest.
Greg, did you have a follow-up?
Yeah, I just want to say thank you all for being here, and Brian, thanks for bringing this forward. I think this is a timely conversation, and it's important that you're all here. Going forward, I just want to keep reminding, or maybe we need to look a little bit forward and decide what our goals really are, where we're going with this, and it ties into the giant Gordian knot of the multimodal, situation with the airport, and all this is tied together. So the best thing we can do is work together and try to come up with. Maybe there are some low-hanging fruit, short-term solutions to try to get us closer to our goals. And I, for one, would certainly applaud shuttles from Brush Creek to Buttermilk and to Highlands on a regular basis, because it sure is nice not to have to try to drive anywhere if I can get on at Brush Creek. Keeping electrification in mind, I'll just keep badgering you all about that and trying to help find solutions. Thank you.
Any follow-ups? Thank you for your time.
So what are you asking us for today?
Well, I think
Once
we
again.
just got informed consent, to moving
He's asking
forward
us
with
for
the
free
offer that
skiing at
SKICO put on. And I apologize, I missed a meeting, so I wasn't as clear on who was managing there. But our intent then would be to enter into an agreement with SKICO for the purpose of managing the lot and offsetting some of those costs.
Right.
And all I heard in the whole thing was something about free skiing at Butter.
That's the takeaway
Kai,
here.
did you catch that?
That's what I heard.
And then I think the important thing that
You're never gonna
was
live that
put,
one.
on the table from our last conversation is continuing those conversations about how do we plan and do the transportation demand management effectively and in partnership. And so
Yeah, and I
appreciate that.
If I could just add, I mean, I think our proposal is not to do this every year for the foreseeable future. It's, I think, a responsible stopgap that gets us back, that requires us to be back at the table and discuss. And I think invite more people in, whether with RAFTA and if it's the high school and the hospital and Health and Human Services and all of us saying, like, how do we do this the right way? And take some of these proceeds next year, a year from now, on the parking at Buttermilk and put them to good use to benefit the community.
One last thing.
Please, Greg.
Only thing I haven't heard is a timeline. What's a deadline for actually delivering something? This is great. I love it. When is it going to happen? When's the key
plan?
result come in? Yeah. When do you think you guys can do this? Is it a year from now, or is it?
I think if we
months?
wait for a year from now, that would be too late.
Agreed,
Respectfully, I think we should continue to schedule our meetings as we have and try to move this thing along so that I'd say preferably you would have 4 to 6 months to start a campaign with the community and say, look, everybody, I know that you've done your uphilling at Buttermilk and you've been parking there for free and maybe a lot of you are using it as its own little intercept park and ride.
Mm-hmm.
And we just want you to be aware that the county owns those lots and that's going to go away in lieu of a feed structure that will support the transit.
So if we could have something by midsummer next year, July, June, that would be great.
Got it. Yeah. There'll be positives to it as well. I think there are a lot of positives to this. So it's not just a burden for the community. I think it can be presented that way.
Yeah.
Thank you.
And Jeff, before you take off, Kelly has her hand up.
Okay.
Yeah, to that end, I mean, we just heard Dave from RAFTA, talk about their sort of scheduling timelines, and so aligning with those, I think would be a helpful next first step. Thanks.
Thank you.
Agreed. Thank you. Thanks for your time.
Thanks,
Jeff.
Thanks, guys. Thanks. Nice to see you
Thanks, Brian.
again.
Thank you.
Jeff, Michael, and Susan, thank you for joining us.
Nice to see you again, Michael.
So we're 7 minutes early. We're moving on to
Do we have staff for this?
linguistic challenges and behavioral health.
Musical chairs.
Yeah. And Kelly, we're just changing over in the room.
Yeah,
Thank you, though. I might be taking it, but
a lot. And there's
Yeah, bye,
funding
Susan.
partners. Who are the funding partners? That's what yeah.
So I'm assuming we have,
Well, if we could get John Peacock,
Kelly, we're just changing over the room and looking for one more panelist, which is likely Jordana Sabella.
I thought we could use the next 6 minutes and do future agendas or something. I'm not gonna wait to sit here for 6 minutes. I know, but it's also good to get home when it's still light outside. Except for the chairs under here.
skipping ahead in our agenda to the review of future agenda calendars, and then we'll get to behavioral health at the bottom of the hour.
Okay. And actually, going into my notes, we do not have future agenda items, and one of the things I was going to go back and do is try and touch base with Lake County and see if we can nail down a date that works for them that maybe has more of our commissioners available. Obviously, that's going to have to come up here fairly quickly in October, early November, or we're going to have a more exciting drive over the pass.
It'll be closed.
And we're still waiting to hear from Senator Catlin, who we'll try and contact again.
Is it worth meeting with someone else on the Senate side in advance of the session? Just to get, I mean, really the goal was to have someone we're really in touch with.
Yeah, it
and
really
given
should-
some of the mountain community
Be our
interest.
senator.
Yeah. There, I mean, are you thinking of Dylan or?
Maybe we invite both Dylan and Mark, given sort of the mountain interests that are going to come up over the year. And if we invite both, maybe both will appear.
I think we should start with our own senator. He's never met with us. We should give him that opportunity without muddying the waters, I think, personally.
I think we've been trying for some time.
Yeah, so I'll do some outreach again this afternoon. And
I have just a quick reminder to the board so we don't get confused. November 4th is Election Day. We are not having a meeting. That meeting has been moved to Thursday, the 6th. It's also a joint meeting with Basalt. Is that correct? Are we having our meeting in Basalt? Or where are we having our work session? Good
we'll
question.
look at that. Yeah, I believe last time we went there, and so I will double check with them.
Okay, so we're not there and they're here, or vice versa. I think that would just be prior proper planning. And
Sorry, I missed that. I don't see that on my future agenda, and this is the first time I think.
it is on the 6th, Thursday the 6th, we're here. And then I remember reading it somewhere, we have a joint meeting with Basalt.
And I'll need to go back and look at that. I know we had folks working on some of those at the board's request. So I need to go back and look. But are you showing it on the
I'm
site?
not seeing it. So we'll need to go back and
For some
check.
reason, I made a note, so it's somewhere in here, unless I was in the middle of the night hallucinating about future agendas, which may well be, I'm not sure.
You were dreaming of more meeting time.
Yeah,
But
and
we
then-
were talking to Basalt about a joint meeting.
And then on, we have Veterans Day is on the 11th of November. It's a Tuesday, that's why we're not having a meeting that day. We do not have another work session scheduled for that week. Is that
Let's get
correct?
work session on Wednesday, the 12th.
Wednesday.
Oh, so we moved it to the 12th rather than the regular meeting. Do you know if anybody is going to be speaking at Veterans Day? Maybe we should reach out to Veteran Services. Generally, we have the chair or vice chair speak at Veterans Day. I'd like to plan ahead if somebody's going to be present and speak, rather than, because I think, Jeffrey, you got invited at the very last minute last time, so. I
For
don't know
John
how
and
we-
Kara, I'm happy for either Kelly or I to follow up with Adam in Veteran Services, and certainly either be both present and or speak, or Lindsay. Yeah.
I don't know where I came up with the Basalt joint meeting.
I'm
in
not seeing
Basalt.
it, Patty. I know we were talking. I wonder if you overheard some dates being thrown
You
around.
get your numbers flipped, the October 9th, the Salt Chamber.
Greg, you're not Mountain Towns this week?
I'm not, no, I'm here. I was concerned about not having a quorum.
Okay.
I apologize for that change.
I think October 9th is Basalt Chamber, isn't it?
I am going to be gone
Yes, it is.
I'm scheduled to be off on the 21st and 22nd, which is Tuesday, Wednesday. I'll be away, but I'm also going to be on the 23rd, which is the BoCC meeting. Just want to give you a heads up.
So, and then for Patty, Northwest COG is the 23rd. So you're going to do COG and EOTC?
It depends if I go to COG or not, because it's our big COG meeting.
Kelly, anything else for future agendas? It's a very loud assistant county manager. Like, I can hear every word.
Talking to
He's
out
40
there.
feet away.
Who's out there?
I did just
Ryan.
want to bring to the board's attention, you probably know, but we added an exec session after tomorrow's regular meeting.
Oh, right, I can't be there.
Because of calendaring, and Rye has some like case updates he needs to give us. It's listed there. It doesn't say what we're talking about yet. I think Rye published the noticing now, or hopefully by now. We should double check that, John, because right now the future agenda for tomorrow just says exec session at the bottom. It doesn't notice what it's for. We all received the email from Rye with the exec sheet and the link, but the public needs to get that info as well.
Thank you. I
Greg?
just want to add, I'm going to have to leave that meeting early tomorrow afternoon. I apologize for that as well. I may have to leave as soon as 4:30 or 4:45. So I'm probably going to miss the exec unless the meeting goes quicker.
I think I'm expecting us to be in exec at like 3, but
Yeah,
maybe
I
I'm
hope
being
so.
optimistic.
Yeah, I hope you are. No, I'll be here then.
Let's just make sure we have a quorum, because Francie's gonna be gone again.
Anything else, future agendas?
I think so. John, anything else?
Excellent, thank you. And Dora, we are back to behavioral health strategic plan.
Come on up.
Sorry, I did have one more future agendas thing. Did John walk away?
John's about 7 feet away and he's fully listening.
Okay.
Kelly.
So we had discussion at our agenda meeting last week about finding some time on the calendar to review county priorities for land use in the land use space and the ComDev space. So if I missed it, sorry, but I want
Kara-
to make sure we.
Kara's scrolling to it as we speak.
Working on that. Kara's scrolling.
It should, hold on one second. I think we had it scheduled. Let me double check, Kelly. I think we said October 21st.
Greg will be gone.
Greg and Francie are gone, I believe.
Francie's
Yeah.
coming.
Okay, well, the 3 of us will give you great. Okay, Q1 land use projects
Yep.
and priorities. Okay.
Yep.
All right, thank you.
Awesome,
Sorry I missed that.
thank you. Yeah. Jordana, Jenny, and Lindsay Maish. The floor, the table, everything's yours.
Fantastic. Well, we're excited to be here today. I am Jordana Savella, on? I think so.
We got a thumbs up.
The Director of Public Health. This is,
I'm Jenny Constable, Programs Education and Partnerships Manager for Public Health.
Lindsay Maish, Director of Human Services.
and we are here to talk today about the Pickens County Behavioral Health Strategic Plan. We'll be going through some context setting, kind of how did we get here, why did we do a behavioral health strategic plan. Then we'll share with you some of the high-level aspects of the plan itself. Then talk through some coordinated funding, 2026 budget, funding partners, contributions, and some next steps. over to you.
Okay. So I've now been here long enough to know I've been here for every one of the strategic plans. I can say that. Does that make me a local yet? I don't know. So this is the third strategic plan that we've gone through with behavioral health. And in the first one that we did, I think was now probably about 8 years ago, the attention was really towards finding any service gaps that currently existed in our system of care and filling them. So the first strategic plan was really focused towards finding providers who were willing to do some of the integrated behavioral health that was needed. That was there were some glaring gaps in our community at that time. So now fast forward to here, and I think that our system of care has matured quite a bit since then. We have new partnerships. We've had some partners step into some of these integrated care areas, like our partners with the Mountain Family Health Centers, who have integrated behavioral health now. There's been some changes happening with Health Solutions West as our primary community health mental health provider, as well as different providers and changes in leadership over the last 5 years, I would say, that have helped really sort of solidify our system of care and gave us a good sense of kind of what existed and then what we needed to do moving forward. And then, of course, we had a COVID thrown in there that sort of suspended some of the planning efforts. And then in the last few years, we've started to pull together again our funders and look to different types of opportunities for us together to start measuring impact, looking at outcomes, and seeing if the work that we've started to put together with the first and second strategic plan have been working. So this strategic plan was really focused on looking at that data, seeing if those gaps still exist, if there's new gaps that have surfaced, and then giving us a roadmap of how we move forward in a very quickly changing environment. So in the last 8 years, we've now moved away from the Office of Behavioral Health to the Behavioral Health Administration. Funding has changed significantly, regions have changed, and how that's impacted us locally is that's what this strategic plan really started to look at. So up to this point, what we've had is the current staffing that has been integral to carrying through our strategic planning efforts was a mental health data analyst and public health, and then we also had some of our human services staffing that was put aside to help coordinate some of the care, which are all going to be themes of things you'll see come through the strategic plan. Our partners right now, we continue to find some really good opportunities with partners as well between our behavioral health, or what used to be called mental health, and now our substance use partners as well. So as things have started to come together, it's been nice to have it's been nice to contract out this work to professionals who have worked very closely with the state and the federal government to help us understand how these things are going to impact us locally.
One other thing I would just reiterate is that the strategic plan that was done was at the direction of the shared group of funders that have come together. So the city of Aspen, the Aspen Valley Hospital, Pickens County's at the table, but not there alone, Snowmass Village, and the school district. So those were our vital mental health funding partners who Lindsay spoke about. Were helping to put money into a pot to fill those gaps in service. They also said, okay, it's time for another strategic plan. And so this has already been shared with them, vetted, and as all of Pickens County, we're coming to share that here today.
Jenny first and then Greg. You have your finger on the pulse.
Oh, I'm the next slide.
Okay. Greg and then Jenny.
Okay, so things have changed pretty dramatically, and it's great to hear your partners are still with us. Our partners are still with us. Is their money still with them, and are they still committed to spend the money? is the bottom line of all this, and that's what I was looking for when I went through this whole thing. Is it sounds like it's going to be an expensive proposition, and are the partners still there, and the funding source is still there, and that's the still big question. You can answer it whenever you want to in the presentation, but that's where I am.
It's in there. It's one of the last slides, but it does show the breakdown in the funding, where it's coming from, which partners are contributing to withdrawal management, to the position to be able to implement this strategic plan, as well as to those baseline services that are helping to plug some of the service gaps in the community. So everyone has committed funds for 2026 and has committed to coming back to the table to talk about cost sharing, additional needs that might be on the table, and what they're able to continue to contribute.
If I could ask, and let's next follow-up is then, regionally speaking, how wide a swath, how wide a pool can we create with this? Because it seems that it will only work better if it's a regional solution. And I'm just
You're
wondering.
getting to the slides that we're going to.
Oh, see, I'm getting ahead of
You're
ourselves.
getting ahead of, yeah, you're
Okay,
getting
got
ahead.
excited when I
and then
read
Jenny.
it.
Question will probably be answered when you get to funding is, has Pickens County committed 2026 funds, and if so, out of what fund? So you can probably get to that, because as you know, we haven't started budget for 2026 yet. We're getting there, but we're not quite there yet.
So those will be coming out of the Healthy Community Fund for 2026.
We haven't agreed to all of those yet either. That still hasn't come to the board, right?
Yeah, that's going to come to the board in November with the recommendations from the Citizen Grant Review Committee, as well as next year's appropriations for the intergovernmental agreements that we have for these services.
Thank you.
Yeah.
Sorry.
I will just clarify what Connie's putting together has included these numbers in the full budget picture. So
That we will
that you'll be seeing
soon.
next week.
Yeah, we can't wait.
And before we go to Jenny, I just want to check in with Kelly and make sure she's still in line with us. Thank you. You're good. All good. I just want to check.
Just feel like it's so much more pleasant to look at the slideshow
Oh.
and not mine.
I just want to check in with you.
No, I'm here.
Rule number
Thank you.
27, working agreements.
Yeah, and sorry, staff, that I'm not there. I have a sick kid at home, and so therefore I'm at home. My apologies to not be there.
Understood.
Jenny, it's all yours.
Thank you. And thanks, Kelly. I completely understand. So for this strategic plan, which began at the beginning of this year, we started with a competitive RFP process to determine who would take the leadership and be our consultant for the planning process. And that was given to SHG Advisors, who, as Lindsay mentioned, had significant experience across the state with the different planning efforts, as well as with state-run initiatives, so really understood the landscape well. And this was supported by the Vital Mental Health Services funders, that group that Jordana described, that has been coming together to fund ongoing behavioral health initiatives in the county for at least 7 years. So SHG kicked it off by examining what's already available, looked at previous plans, what's been presented in our area, as well as best practices around the state. They held extensive stakeholder engagement as a key component of the process. There were 9 partner meetings, 24 structured interviews, and 7 focus groups. And then for transparency, SHG implemented a landing page and held weekly leadership meetings with Public Health and Human Services, as well as kept an eye on changes in the broader behavioral health ecosystem. Oh, and this one, yes, we can go ahead and put all of it, at least those 2, yeah. After that initial scan, their first finding that they came back to us with is that there's already a lot of very strong work going on. As Lindsay mentioned, we're talking about filling in. Our ecosystem has really grown. Our system of care has grown tremendously. And there are a broad array of partners that came to the table for this. So some of those are shown on both sides of this slide. All of these folks were involved in the behavioral health continuum continuum of care and participated in this planning process. That middle section shows the approach, creating a shared vision, establishing strategic priorities, determining the best leadership and governance structure, all of which are supported by coordinated funding for a greater impact.
Oh, this is me. Yep. So I'm not sure that you all are aware that I'm now sitting on the State Behavioral Health Advisory Committee, the Behavioral Health Administration Advisory Committee, as well as the Treatment for Persons with Behavioral Health Disorders in the Criminal Justice System. It's a very long acronym. It's like 10 letters long. So I've been sort of on the forefront of understanding how some of these broader system changes may be impacting us locally. These are 5 really big ones that we're keeping our eye on right now, and also know that we're already starting to feel some of the impacts from. So the Behavioral Health Administration Service Organizations, also known as the BoCCs, you've heard of them referred to that as well. There was a big change in the last few years around regions and coverage and who was covering what, and they RFP'd these services and have new providers in a lot of these areas. So we have felt some of that transition with our partners, Health Solutions West, as well as Rocky Mountain Health Plans. That speaks a little bit also to our regional provider transitions. We've had some leadership changes happen regionally. Of course, Health Solutions West, we saw new leadership come on board with the Hope Center. We've seen new leadership with headquarters. We've seen new leadership really across the board in our behavioral health providers. So also just kind of keeping an eye on the coordination around that and being curious, staying curious about that. I'm not sure you're aware that the detox licensing, that our current detox here in Pitkin County will be overhauled. It was supposed to be effective July 1st, 2026. They've now extended it to July 1st, 2027. They're effectively removing detox licenses and hoping to watch many of those service providers turn into crisis stabilization units or walk-in crisis centers. And I think that switch is really intended to help integrate behavioral health, both substance use and mental health disorders as well. And also it probably saves money in the long run as well. The Youth Intensive Services expansion is related to our Family First Preservation Services Act, FFPSA. And there has been, since that change has occurred, there has been some pretty big gaps in the system of care at the state where there are not enough residential beds and not enough in-home service providers to help support kids stay in their home. And if they can't stay in the home, they have to go to a residential facility if it's a higher level of care. And we're finding, at least even through child welfare, that we're sending a lot of kids out of state because there's just nowhere for them here in Colorado. And then, of course, number 5 is no surprise to any of us. We're seeing a lot of federal budget cuts when it comes to behavioral health. Both federally and at the state level. I think the most recent figure that I heard from the Behavioral Health Administration was in the next year, they're already looking to cut something like $46 million from their budget. So as we're kind of keeping an eye on all of those things, we're realizing that will have impacts on us locally in terms, especially around of how we're coordinating care.
So back into the plan. After doing all of the work that Jenny described, SHG consultants came to us, narrow it down to 6 goal areas. The first being governance structure, so ensuring plan implementation by making sure that we know how we're going to be governing ourselves, coordinating funding to increase impact. The third, and we'll go into each of these in more detail, but the third is building a coordinated resource navigation system. Fourth is strengthening the behavioral health continuum from treatment to recovery. 5, improving access to services, and 6, ensuring a strong behavioral health workforce. You'll notice the first two are very much structural. So looking at what do we need in place to be able to do the work, and then goals 3 through 6 are really what is the work. And the way the plan is outlined is those last 4 goals are what we would be using work groups made up of community members who have expertise and touch these different areas, who would be able to really help us delve into the issues and find solutions together.
So for goal number 1, our first step is to ensure that there's a governance structure in place to support the implementation of this plan. For that structure, we found that there were not any other natural backbone entities in Pitkin County or the region poised to carry forward the work. So the suggestion is to go with a county-led model at this time and review within 3 years. We have done additional research around this and determined that the best chance for success for this plan is to ensure that resources are dedicated to the work. This has been echoed by the Katz Amsterdam Foundation, which has been doing work with other mountain communities. We've met with them several times and learned that as they've studied communities that take on behavioral health systems work, the presence of a backbone is key to that success. Within our departments, we determined that public health is best positioned to be that backbone. Public health would take on the work described on the slide and act as the main facilitator for a behavioral health strategic plan, as well as reporting on the progress. Initially, public health will convene the advisory group, which is that center level of the slide, and then add the work groups as we get to those areas in the plan. In order to do this, we would be sunsetting a current position, which is already term limited, to initiate this work and keep the budget at a net $0 impact. And again, we also plan to keep looking forward to hopefully find an organization that can carry this work forward in future years, ideally on a regional level. So next step would be after approval of the budget, to move forward with hiring a full-time 3-year term limited employee in early 2026. That would be the behavioral health facilitator or behavioral health program administrator. Estimated cost is approximately $175,000 for the salary and benefits of the staff member, a portion of the supervisor's time, and necessary materials and operating expenses. This would, again, have no budget impact and no increase in total full-time equivalents because the data analyst position sunsets at the end of 2025. And as an aside, that was a remarkably helpful and strong position, so this was a difficult decision. It would have been great to have both, but we decided to prioritize ensuring that we move forward with the plan in a timely manner, especially seeing how much partner participation we had. There's really strong momentum among the partner organizations. So the funding has been approved tentatively for 3 years by the Vital Mental Health Services Funding Group, and the position would be split between governance and funding duties. There's a detailed position description in Appendix C, but they would oversee advisory group and work group logistics, as well as recruitment and onboarding, partner relationships, internal and public communication, and development of a landing page and engagement tools for both partners and the public.
I'm going to add one thing to this slide, just to address, Greg, some of the questions that you had about the regionality of some of this. Those advisory groups, and well, especially the advisory group, would have regional partners. We recognize that in Pitkin County, we have stayed pretty insular to our county and the work that we've been doing. And there are, in the strategic plan, there are recommendations for us to be looking to partners like Vail Health, others up and down the region to start really exploring whether there's opportunities for us to bring, to your point, more partners to the table to look at more of the regional solutions. I also suspect with the detox and some of the substance use changes happening, we're going to have to look regionally to understand how we can work together in addressing some of those issues as well.
Great, thanks.
Patty, and then Greg.
Go ahead, Patty.
Do you want to respond to that?
Oh, yeah, I just want,
I'll
yeah.
go after you.
I just want to say, yeah, thank you to that. Immediately, I guess my response, or the question I wanted to bring up was, working Vail for the mental health facility now that's in Vail, that perhaps makes sense, right? It'll be interesting to hear how they can, if those two activities can work together. Not knowing anything about it, I wonder if that's, well, I guess we're going to find out if detox and behavioral health can share space like that. The job description was really heavy to me. It seemed like this is a huge workload, and I wonder if you're going to be able to find somebody who can do everything you've laid out in this. From having read through the packet, it just seems like this seems like more work than one person can do, and I want to make sure we're being realistic. It's a 3-year commitment we're talking about. Partners are paying in as well as us, or is the $175,000 just from the county?
All partners.
Sure.
The partnerships are paying for all of it. Can you imagine that growing to a larger number of people to get the job done? You know, just I think about the website and the platforms and how we have to change those here so often. Keeping up a website and a platform seems to be beyond the abilities of most organizations to be timely. And so I'm just wondering, I want to make sure that we're prepared for the workload ahead.
I mean, I think, we'll be able to accomplish what one person, hopefully one very well qualified person for the job can accomplish. We've got some support within the department. So the webpage will start with just doing a page within the public health webpage. We've got some admin support that can help with that. But I think that we will see how big this job gets. If you see in the strategic plan, we have laid out that not all of these work groups are going to be going on at the same time because, to your point, it's just too much for one person to handle. So there's been it's staggered how much work can happen. And also, our partners in the community, there are a lot of the same partners who will be working on some of these same goal areas with us. So, the first year is really thinking about that, getting that structure set up in place, and then moving into some of the content area and convening the groups. As for we think it's reasonable, but it is a tall description, and as you know, we can only do as much work as we've got capacity for. So.
Patty,
My
I think was
question,
next.
I'm a little confused. God, I seem to be a little confused a lot today. So we have a data analysis person who's term limited. So now we're talking about a full-time behavioral health champion. Is that the same position that we're going to be, the data analysis person will go away, that position goes away?
It's repurposing that position to a new position.
To a new position?
It's
So we're
taking
going to
that
be hiring a
FTE.
new full-time FTE.
So the 3-year term position ends this year. So that is going away. The request that is coming before you is a new 3-year term limited position.
Data analysis or behavioral?
The behavioral health. So the data analysis is term limited. It expires at the end of this year. There's no request.
And that's going to go away.
And then working with the funders group, they're in support of the dollars that have supported that existing 3-year term limited, is to continue that with a new 3-year term limited position as this behavioral health facilitator.
So how was the data analysis position funded?
Through the same structure as proposed now.
Funding
Through the
group, not just directly through Picken
Correct.
County?
Correct.
Okay. We've got a lot of requests coming before this board with even more limited funds, as everybody knows. So this is gonna be an interesting year to prioritize where our dollars are going and where we might need them to go, because we don't, as you guys really well know, what's coming down from the federal and state levels. What's not coming down from the federal and state levels, which is dollars. Okay, so thank you for that clarification.
I don't know if this is helpful, but I'm going to be coming back before you on November 6th to talk more about the Healthy Community Fund as well, because these funds come from the Healthy Community Fund, and we're starting to look at some strategy as we move forward into the next year, especially around, number 5 on the big issues like funding cuts that we're starting to see, and kind of how we're looking at that funding and where the priorities need to be around it. So I know that's like a little bit of a spoiler, but
Well, we're trying, we've been discussing at this board, trying to have our priorities kind of have some discussion before we start budget.
Yeah.
Because we need, it's gonna be tough. I think we're all feeling that squeeze.
we know.
And it's really difficult for us to take some of these projects that are really in the best interest of so many of our constituents. And we see the whole picture that some departments don't necessarily see what's happening on all fronts like we see them. So that's a spoiler alert. Back at ya. Okay, thanks.
Jenny, I think you've got the slide.
Okay, I do have the slide. And Greg, just to fill out a little bit more to your question about what one person can do, while the content is different, I see a lot of similarities between this and the PACT manager position, PACT administrator, because that person is running multiple groups of partners. And it'll be, at this moment, more like starting up a new program, establishing what partners need to be at the table and so forth, and that structure and so forth. But again, I think that's another clue to us that is something that can be taken on in a few years. So moving on to goal number 2, if there aren't any more questions about goal number 1 at this time. So that goal number 2 being coordinated funding to increase impact. SHG looked around and they really emphasized that there are a lot of different investments being made in the behavioral health system in Pitkin County. This is just a sampling of that. Not only the county, but many different groups are contributing to efforts to increase the behavioral health services that are available to our community.
I noticed general fund is mentioned up there, just to point that out.
So kind of in our strategic first steps toward coordinated funding, the challenge identified is that despite all that funding, our investment is kind of fragmented and duplicative. So we want to make this part of the system more streamlined and effective. So the desired outcomes are to reduce duplication, improve communication across funders, grantees, and applicants, promote complementary investments, and enable a long-term systems level impact. I see this, like one example would be working with funders to streamline grant application processes so that nonprofits find that more simple across different applications, just as a really concrete example there. We've already started working toward this by bringing together the withdrawal management funders group and the vital mental health services funders in preparation for aligning them in 2026, which Lindsay will talk about in more detail shortly. The long-term goal here is to establish a formal collaborative supported by a dedicated backbone entity. That entity would convene and coordinate funders, facilitate information sharing, and align and distribute funds strategically.
Okay, so now we're going to delve into the next 4 goals, which are really the work. So we've got the structure set up. Goal number 3 is to build a coordinated resource navigation system. And so when SHG came in and did their assessment, again, they continued to say there are so many resources in this community But the number one issue folks were having was navigating to the right resource. And so the goal there to be able to solve that problem would be to establish a formal community-wide resource navigation system that connects individuals and families to services and enhances that collaboration across sectors. This is not just for behavioral health services. This is even thinking upstream of access to food, access to childcare, housing, other kinds of resources that folks might need. And so the idea is
Concierge.
That's right.
yes, have this kind of centralized access, intake, and triage, and then have that wheel be able to connect in with these 4 different areas. So 1, navigators. We know that there are some really great resource navigations and organizations that do this in our community. Aspen Family Connections does this for children and families very well. PACT does this for folks touching the criminal justice system. Recovery Resources does this for folks who are either using their withdrawal management services or homelessness services. So we've got some pockets of excellence, but no one large system. That next piece is that cross-sector collaboration. We've come to realize that there's still needed some regular coordination and meetings, knowledge management of these folks who are on the front lines doing that navigation. Outreach, thinking about how the general public or folks who might need these services know about them or know where to go. And data tracking always. What do we know? What are we doing well? What resources do we have? Where are those gaps, and how are we working to address them?
I'll add one thing to this. What I find so interesting about this is that these are the very similar to the recommendations that came from the Criminal Justice Coordination Committee, as well as the Homeless Services and Infrastructure strategic plan as well. So the fact that we're seeing this come up as a gap in all of our different strategic areas, I think is really telling.
Thanks, Lindsay. Goal number 4 is around strengthening the behavioral health continuum. So SHD did a scan for us and looked at services all the way from prevention and early intervention through treatment and recovery. And the priorities that they have for us to really be thinking about focusing on in the shorter term are around assessing and building up alternatives to the inpatient care. Lindsay talked about some of the reasons why that is even more important now. Evaluating the need for dedicated beds. So are there resources other places? Are we having trouble getting folks in? Is that a model that we could explore? We've got questions, and this is a great opportunity to explore those. And then finally, leveraging telepsychiatry consultation. We know psychiatry is really difficult to come across in a timely manner in our valley. And so can we use some of these other technological solutions? In the longer term, there are strategies like identifying new services or levels of care, reimagining recovery facilities through a local regional framework. And I think, Greg, this might also get to some of your questions about when are you thinking about regional solutions? And what we know is that if we just jump to regional solutions, we often lose what we need here locally. So thinking about what can we provide locally, what makes sense to provide locally, what do we have the volume and capacity to provide locally, and then what needs to happen at the region, and then how do we have those conversations and partnerships to be able to do that is some of this more strategic long-term work. And then finally, assess and potentially redirect funding to strengthen that behavioral safety net. And that's goal 4.
Quick question. Just before COVID, I know we had mental health first aid courses coming into the community, and is that still a thing? And how coordinated are you, or are you planning to work with the nonprofits who have like a volunteer basis, where the people we're getting the citizenry to go out and learn mental health first aid? is that still part of this, or has this become more in-house?
Do you want to talk to what we
Sure.
do?
So there's still a little bit of funding in the PACT program in our grant funds to offer mental health first aid. And there has been a local provider, Kat, the co-responder, is trained to conduct the mental health first aid classes. So those have been continuing, and PACT has been doing some outreach on that. If you have additional ideas of places that you think would be interested in knowing more, the participation has been steadily growing in those classes as we offer them every 6 months or so. So I think that that's a great trend, and we'd love to reach out to more community partners that might be interested in getting folks there. It's been offered free to the community.
Great. Yeah, I just remember we were introducing it into the schools right as COVID hit, and students were coming and taking it. And I think the youth center was picking it up as well. So I know there may be opportunities there, but I hadn't heard about it in so long. Thank you.
You're welcome.
Excellent. I'm going to go to Kelly first. Thank you. Kelly, and then back to goal 4.
Okay, thank you. I'm wondering, when I look at the outcome measures for this goal, will you need to create some like data collection architecture to be able to deliver on these outcomes? Is this information already being shared amongst providers?
So in a variety of different ways, but for each of the goal areas, there are, Kelly, it looks like you're looking at the strategic plan. There are a number of measurable outcomes that are recommended to be considered. And so the idea is that when Goal 4 work group gets together, they're examining this issue, seeing what they want to work on, and also finalizing and those outcome measures. What do they want to measure? Where is that information coming from? How are we looking at that information over time to be able to see if they are making a difference in this goal area? I don't know if that answered your question, Kelly. So we've got a whole bunch of different measurables and deliverables, but I think we don't have them finalized yet. We have ones to consider that this work group will help us hone in on.
Okay, thank you. I mean, I think they're meaningful. I'm just curious as to, like, whether you are already measuring wait times for psychiatrist referrals, and if everyone's sharing that information collectively or not, just as an example.
Okay.
Back to Jordana, sorry.
Okay, great. Goal number 5, increasing and improving access to services. So the recommendations in this area are really around starting off with maximizing the impact of the Mental Health Fund. So the Mental Health Fund is a pot of money that Aspen Community Foundation has fundraised. They give that money to the headquarters organization, who is then responsible for distributing that to providers who identify that they have a patient who is seeking behavioral health care but doesn't have the ability to pay. So that is a resource in our community that we realize is being well used, and we could always make that pot bigger or make the dollars go further. Additionally, we can identify further incentives for providers to accept commercial insurance. We know we've got pretty low rates of commercial insurance that are accepted here for a number of reasons. So we think this is worth examining. Exploring reciprocal licensure, which would allow more folks to be able to practice here, and also leveraging existing state programs for youth that exist, but we need to learn more about them and how especially these programs, youth in our area, would be able to access them.
Question about reciprocal licensure is just somebody from another state could practice here using somebody who's already licensed and a qualified professional elsewhere could work here. Okay. Just want to make sure I understood what that meant.
think that's a program that was just implemented over the last year or so, because before, I mean, I moved around this country and I'd have to get relicensed in every state that I worked in. And I don't think California will be part of it still, because it's pretty heavily regulated there. But Colorado is definitely one of the states that's on the reciprocal licensure list. So that's great.
And the last goal, number 6, ensuring a diverse, skilled, and community-rooted behavioral health workforce. We know that we need to have the people, the workforce, to be able to do this work. And so the ideas within this goal area are really to incentivize future and current behavioral health professionals. How do we do that? How do we promote behavioral health careers to broad audiences, to kids, up to folks who are figuring out what their professional path may be? How do we leverage online platforms and also expand and strengthen formalized peer support networks, so that once we do have folks who are in these positions and careers, how do we make sure that they still have the support that they need to be able to continue on in this career path for many years to come?
Can you explain the color chart, the charts? There's no, you can have a legend on that. I'm thinking, what does that mean? I love it, but what does it mean?
I can take a crack at it. So as the color gets darker, that means there is a higher density of behavioral health providers. So the tan color is the area that has the lowest sort of saturation of behavioral health providers. Pickens County is mostly yellow. That is the next lowest level. And then as it gets darker, that means there are more and more providers. So like Denver is a really dark color because there are a high percentage of providers to the population.
So Eagle County has a much higher percentage of providers than
Garfield.
Is that Garfield?
That's
or Eagle?
Garfield.
That's Garfield.
Garfield, so
Okay.
Glenwood Springs area.
Oh,
I
you're
think.
right.
The one in the southwest corner.
Is that
I can't
Durango?
see the county. What's
Durango, what is that?
Archuleta, and then to the
Montezuma.
west.
Montezuma?
You can kind of see where the community health providers are, like
I know,
Access
they're in the
Health is where
southeast
Durango is.
southwest
Yeah,
corner
we
of the
have-
state.
Yeah, we have a lot of headquartered sort of in the Glenwood Springs with Health Solutions West we're looking at.
Right, okay.
Yeah,
thank
so
you.
you see.
Interesting.
Lindsay, this one's you.
Oh, boy. Okay. All right, coordinated funding. So as we went through this process, one of the things that really struck us is that, Jordana and her team were convening the funders around the vital mental health services. I was convening the funders around the withdrawal management. And of those, there's only really 2 differences in funders. So we thought with this plan, it starts to bring together also substance use and mental health, as there's often co-occurring and they're treated similarly through the continuum of care as well. So one of the things that we've already begun and started working on is aligning for the 2026 budget these 2 so that they're all located. Withdrawal management, vital mental health services are going to come together into one fund now. We'll continue to use the same formulas, but instead of us convening these partners 2 different times, we're going to be convening them all at the same time. Some of those advisory group and work groups are going to help us further define some of that as well. So we, is our public health becoming, yep. Do you want me to talk about that, or you? The backbone?
Oh, just, it's the same concept that was around goal area 2. So public health will become that backbone for now, that is not only implementing the work, but also the shared funding model. So that is some of the work to come.
In some ways, Greg, just to start also to keep answering the question that you asked before about regionality, one of the things that Aspen Community Foundation has done right now has been the, I'm not going to say backbone, but the primary point of contact with Cats Amsterdam. And so they've started requesting funds on behalf of many organizations for behavioral health and substance use disorders. So what we would hope to see over the next few years is sort of a natural backbone organization start to surface. But with the absence of that right now, we need something. So.
Interesting.
I have a question for Greg. If you mind.
Please.
Has public health discussed becoming the backbone?
The Board of Health?
Yeah.
We haven't had that discussion, or at least I haven't with the Board of Health yet.
Okay. We just need to find out what resources, we all get stretched too thin, and when that happens, sometimes nothing gets done, or sometimes priorities shift. So I think it's important that we make sure we have capacity, whether it's hiring, repurposing that position, or coming back and asking for more positions. I think that would be an important discussion for Greg.
And I think in some of the recommendations coming forward of where does the backbone sit, part of it came from the work that, and I think a lot of the community trust building that public health has been doing, and recognizing it not wanting to be a long-term goal that it sits with public health, that it wants to be that seed. Somewhere we need to have that seed organization, and so being able to lean on the work that's already been done with, hopefully, as Jordan and Lindsay are saying, maybe giving some time to other organizations in the community to step into that space.
Okay, and this is just showing you the budgets and contributions for now this joint funding model. So in the first column, those are the vital mental health services, contributions in green. So anyone who's got a number next to them is a funder of that effort. As Lindsay said, we've got 5 funders there. Withdrawal management also has 5 funders. The addition of the town of Basalt and the subtraction of the Aspen School District. And then you can see in the right-hand side in the red, the budgeted amount, so the expected expenses of what these joint funding efforts are looking to pay for. So the Aspen Hope Center has a contract for school-based clinicians. Mountain Family Health Center provides integrated behavioral health care. Recovery Resources provides intensive wraparound services case managers, as well as the withdrawal management. So we'll be combining those two into a contract. And then also the behavioral health program facilitator that is intended to be hired by the Public Health Department. So the grand total is about $1.5 million in behavioral health related spending.
Can you go back to that slide? I just have to question. Pitkin County's looking at almost $476,000. And that's coming from,
The
not
healthy
coming from the
community.
healthy community, all of
Yeah.
it's coming from
Yep.
Healthy Community Fund?
These are all our intergovernmental agreements that we have. Yeah. Mhm. And I can't wait to come talk to you on November 6th more about that.
Well, it's going to be interesting to see, because from what, I don't know if the rest of the board and I, you're probably hearing from different sources, that the Healthy Community Fund is being asked for a lot. And we knew that it's been, gearing up over the years, and this year's going to be a big year. And I think it's going to come down to that broader discussion of where we're prioritizing those dollars. We'll see where the recommendations come to us, but they are recommendations that come to this board. So I just want to let everybody know things are subject to change, depending upon, as I think we all know, what happens today, tomorrow, and the next hour in Washington, D.C.
Right.
Or in Denver.
Well, and a reminder, too, that the Healthy Community Fund is intended to build a social safety net to keep people safe and healthy. And so these are exactly those types of services.
Well, but everybody
right
says
there.
that to us.
Right, right.
But that's a good point. But we hear that from everybody who's asking for dollars. They find a way to fit into what the priorities for the original intent of Healthy Community Fund, which has changed over the years when we had more money to allocate out. And then we're gonna have to look at, and that's gonna be a tough decision for this board to have to weigh those requests coming in, because it'll be interesting to see where the committee comes out with recommendations and how they can stretch a dollar as far as possible.
Kelly, did you have a question on Jenny's budget slide?
I had a comment.
No, I don't have a question. I mean, I will comment that, it looks like the combined total of all of our municipal partners is matching just about what the county's contribution is. So I'm grateful for that commitment, because we don't see that across all of our human services opportunities. So that's great. Thank you.
Thank you. Greg?
Right, I was just calculating. So Pickens County's in for 31% of this entire budget. I appreciate what Patty's saying, because we are feeling the budget, the ominous, concerns about budget that everyone has noticed. But it's gratifying to see that we've got partners that are stepping up to the extent they are, and that we're in at 31% and not 95 or 100% is really gratifying.
It's good work.
The Vital Mental Health Services budget has not grown in the entire time that we've had it since the first strategic plan. And it sounded to me when we met with these partners that there is interest to take a deeper dive into this and to understand what is needed and what money is going where. Since the Vital Mental Health Services funding strategy has not changed, this is the time for us to look at that. And I think this person that will be hired is going to be looking at those probably first.
So this just lays out some of the next steps here. So hopefully the behavioral health facilitator position, pending approval by the county budget process, we can hire that and get this work kicked off in January in earnest. There's been an acknowledgement of those funding partners to want to reconsider the funding formulas, to Lindsay's point, and see what's needed, how they should be coming together. And I think that there has been a lot of trust that's been built in working together on these in these areas for years and years. And so I think that that's a great base to be able to see where we can go next. The landing page is being developed right now so that we can share the work that is happening. So that is continuing. And the funders are planned to come back again in the fourth quarter before Dave Ressler retires and before we kick off in the new year.
So we're in the fourth quarter, right?
There's 3 months in the fourth quarter, though.
I'm like, where are we?
Oh my God, we are in the fourth quarter.
We are. And the meeting's scheduled for November already. It's on calendars. So we do have a good amount of time left for questions and feedback. But wanted to start by asking all of you a question, and also to just say thank you I can see how much you've all delved into the plan and have so many detailed questions, and I just appreciate everyone's commitment to this work. It's near and dear to my heart, and it's so fantastic to just see everyone coming together around it. We're curious what part of the plan is most exciting to each of you with what you've heard so far.
Greg?
Oh, I was just going to throw out that you didn't include the caterer.
The caterer who's feeding
Catering
people
the
at these
workshop.
meetings. Oh.
That's always the most exciting. Sorry to throw you off there, Jenny. Scratch that. Take that off, Andorra.
You got a hand raised from Kelly, though.
Yeah, this is a bit of a question, but it is something I am excited about, and that has to do with, and I moved off of the document. Let me see if I can pull it up. But it has to do with sort of the measuring the health in the community, sort of the, existing and then improving health metrics for behavioral health and substance abuse and things like that. And so I guess I'm wondering, can you just describe a little bit of like what that looks like now and whether that is something that will get kicked off kind of in an early phase of the plan so we can measure it over, I think this is a 5-year plan, if I understand correctly, or whatever the term of the plan is. Because I think that'll be just really interesting to understand.
I don't, report card? Oh. On the progress of the plan? Or the, what Audrey, yeah. If you want to talk about what Audrey's working on, I can talk about the plan report.
So, do you want to talk about the?
You guys can talk to that.
Lots to talk about.
There's a couple different ways that this could go. So the landing page that we're working on right now will have both some measures of progress toward implementing the plan, kind of like that thermometer toward our, where are we in the process. As well as a couple of measures that we're referring to as a report card that will look at the health of, trying to look at the level of health on a behavioral health landscape in the community. And that is something that our data analyst is working on right now before her position sunsets, because she's the one that is most steeped in all of those different numbers and figures and what they tell us and what they don't. So we're working to distill those down to a few measures that will help us be something that we could look at over time. So yes, to your question, that is something that we plan to start looking at soon so that we can look at progress over time, over the length of the plan. And then the term of the plan, do you want to take that or would you like me?
It's just we've got 3 years of the plan, but as you may have seen, the 80-page document has many, many appendices and detailed detailed pieces of information for these different work groups to be able to start with. So I think that it's a lot to be able to, it will move us in 3 years. We won't have accomplished everything that has been laid out in the plan in 3 years. It was a very kind of living and ambitious document.
Yeah.
Well,
Greg.
That's the thing that when I read it, it had a lot of promise, and that there's so much we want to do here. What we're able to do is, I think, yet to be seen, is what I'm hearing based on the capacity you have. A few years ago, or maybe several now, I remember handing a book out to everybody in the admin about OKRs. It's a strategy for growing organizations very rapidly that was developed in the technology, Silicon Valley, computer companies that were scaling up for internet and things like that. And OKRs is objectives and key results. And now RAFT is using it. And when they come, they report about, well, these were the objectives, and here are the key results beneath those that we're meeting. It'd be nice to take a look at that. It may actually be an incredible tool to help make it easier to put all those ambitious goals into into the list of results under the objectives, and be able to check them off, or just understand what capacity you have to complete them. And that would be really helpful, I think, for us as we're looking at this, because, it has a budget associated, but we're not sure if we can accomplish the outcome, and we'll get as much done as we can. But that part is making me a little, is the only trepidation I have. I think this is necessary and it's wonderful, but, it sure would be great to track, as Patty or someone else brought up, Kelly, track the progress so we really know if we're getting what we need to get to for the money we've got to put in. And so that just might be a tool. And if I can think of the name of the book, but they're called OKRs. If you look it up, you'll find it. Plenty of them. There's probably 1 or 2 upstairs still. Thanks.
Patty.
May I?
Please.
I'm gonna throw something which I think is very exciting, and it's just kind of evolving. At the The tragic passing of one of our young local farmers, the family has created a 501c3. It's Casey's Fund Supporting Farmers. It's through Seed Peas. And their number one objective is to address mental health issues. It's a voucher program. It also addresses physical health, dental health, goes on and on and on. And talk about regionalism. It is going to be servicing farmers, ranchers in need in Delta, Pitkin, Garfield, and Eagle counties. They're already lining up local practitioners. There's a special training that they've been receiving that's specific to farmers and ranchers' mental health issues. It's a huge portion of our valley-wide population that is at risk. Suicide rates, believe it or not, which shocked me, in farmers and ranchers is significantly higher than I think you would imagine because of the stresses of the work they do and the isolation under which they spend so much of their time. So if you would like, I can get you in touch with Bob Piscura, who is helping to organize this effort. I'll be honest, the family's talking about adding me to their board of directors, which is an honor. We're still evolving. But it's a great opportunity for partnerships to service, again, that sector of our population that people don't think about that are in need of mental health. So I will talk to you guys about contacting Mr. Piscura. He's an amazing man with a huge heart, and he understands it, having lost his son recently in February. So I'll get you guys hooked up. Thanks. And if you want to come work on the farm, it's
Is that
really
the place
hard
that work.
work.
Built that new facility? It's Seed Piece that just built that big new facility over on Snowmass?
No, Seed Piece is on 133. It's on Sunfire Ranch. It's up above Sustainable Settings. It's kind of tucked back up into the draw there. But they do great tours for families and kids, and volunteers days are on Friday afternoons at 1:30. You can come and tour, or you can come and weed, or you can help harvest and be prepared for the next morning when you're too sore to get out of bed because it's hard work. But it's great for your mental and physical health. Thanks.
Thank you.
Kelly?
Kelly McNicholas Curry.
Thank you. Sorry, the thing I was referring to before but couldn't find in the plan and just found in the plan was the report card. I'm curious as to what you all are thinking about that relative to sort of the snapshot of the community health level of data.
Thanks, Kelly. That was what Jenny was just referring to in terms of the report card, to be able to track the progress on those community health outcome measures over time. And then there's another tracking mechanism in the plan that's more like a thermometer to see how well we're accomplishing the different steps of the plan as time goes on.
Right. So do we have anything similar to the report card now, or is that?
No, we have.
Is that something you guys will look at earlier on? Like, what is our initial snapshot? And how are we to measure then over the next 3 years?
So we have a lot of data and information that we look at based on what specifically the project is that we're looking on to address. So every 5 years we do a community health assessment. Behavioral health data is a part of that. We were collecting specific data around our MHAP program, looking at what kinds of individuals were seeking, needing really that care coordination, what were those gaps in services. So we've done different data collection processes over time with different focuses, depending on the question that we were trying to answer. But at this point, we don't have a set number of behavioral health indicators that we have selected, chosen, and report on our website. So the report card will be the first version of that kind of data being used in that way specific to behavioral health. And I think the most challenging part of that process was really narrowing down all of the indicators. Because again, right, it's a report card, it's a snapshot. There's so much information that we have, but sometimes just being able to help share that and tell the story and look at it over time that will get us a good picture as well.
I think, Kelly, the other thing
I think that's great. Oh, sorry, go ahead.
Yeah, I think the other thing I hear you saying is, and I feel like we've been talking about this for years, sort of, and how does food insecurity impact someone's mental health? And how does self-sufficiency or poverty or things like that? And are we looking at those in a way where we can start to see some correlation or something like that? And I do think there's a lot of opportunity at the staff level right now for us to be coordinating with departments like community development, the 2050 plan. We're all doing our own strategic planning right now and making sure that all of those things are talking to each other, and then ensuring there's one place that's tracking it. And so we're not siloed out and saying we have this behavioral health strategic plan and it's measuring this alone over here, but instead that's being reported into a broader system. And I do think that the 2050 plan is shaping that right now and starting to show us. And so though the behavioral health strategic plan might have these, let's say, 5 indicators or KPIs or KPRs, KRPs, I don't know, the ones that Greg said, that are for the local level, what we're doing here. Of those, there's 1 or 2 that are really important to make sure that someone has their eye on at the community level. Not just over here in the behavioral health strategic plan. Is that helpful? Does that help?
Yeah, it does. It's super helpful. I just find that, they can be a little cheesy at times, but I find report cards to be like a really useful tool for like the greater community who is maybe not super engaged in these things, to be able to look and say like, oh, like our suicide rate for men over 50 is coming down, or onset of alcohol use in 7th graders is coming down. You know what I mean? Like things like that over time, as like a true tool of like what is the status of the community health picture of it, not just necessarily the users of the systems and the stakeholders of the systems. So I'll be glad to see that, because I think it's just a tool that can generate broader understanding and buy-in for this work.
And I love the little people. That's my most exciting thing. Hate to tell you, but it would have been fun to color them in. It's good for your mental health. Stress relieving.
Anything further for Jenny, Jordana, and Lindsay?
Can I just jump in again? I do just want to take a moment to acknowledge that, this is like, you've come a long way, right? Like, I don't even know if we had a public health department when I started 6 years ago, and so to sort of coordinate and there wasn't great coordination among the partners and public safety and all that. So, you all have had a lot of accomplishments, I think, over these years, only a handful of years, frankly, to keep building on.
Public health used to be run through community health, because I sat on that board years ago, and then we brought it in and kind of combined 2 and then split them off. So Kelly's right, it has evolved enormously, and under a lot of pressure when you first got involved. So thank you guys, appreciate it.
I just want to add to what both Kelly and Patty just said as well, which is that it took that many years for us to be able to get where we're at right now. And the reason that we can now actually start talking about a report card and KPIs and things like that is because there was no infrastructure around this coordination before, and now there is. So now that there is, you're right, there are organizations that are gathering a lot of info. They have their own strategic plans where they have they're measuring suicide rates and, things like that. where we can also that facilitator can start to bring some of that together into whatever is in this strategic plan and figure out what makes the most sense. But we couldn't have done this when I started 8 years ago. We couldn't have done it like this because it was just about filling the gaps at that point.
Given sort of the ominous omnibus, that was an HR1 joke.
I didn't get it.
Are there other community partners in the Roaring Fork Valley we should be bringing to the table, knowing there's sort of clouds on the horizon? Is there someone else? I mean, going back to the funding slide in Greg's percentage terms, someone else we need to bring to the table, whether that's corporate or otherwise, for 26 and beyond?
You're always looking for funding partners.
I mean, you all tell us too. I think we've been building some of these partnerships. Back when we started, Snowmass Village wasn't a part of it.
Right.
They were like, "Hey, we've got some tobacco tax. We hear you're doing some mental health work. Can we be a part of this?" So, we've had some funding partners through, like when Rocky Mountain Health Plans had some additional funding. They came, they said, "Wow, look at the work that you're doing. We'd like to help support this," kind of a one-time infusion. So there have been, it has grown naturally, I would say, a little slowly. But if we can think of a partner, we're talking with them. We're talking with Aspen Community Foundation about what their goals are, where they're going, how does it align with this work. I think there's a lot of different conversations that are happening. Lindsay's, and this is specifically for the behavioral health work. Lindsay, I don't know if you want to talk about your regional grantors group and if that applies here of how y'all are thinking regionally. Or no.
How do I talk about? Yeah, I think we'll probably talk more about that on November 6th. But that group is in its infancy stage right now. But I do think it starts to open up, Jeffrey, to your question around, and actually what everyone has been asking about, which is how do we ensure that the dollars that are being spent are being tracked in a way that we're measuring impact to ensure that it's working. So that we're being good stewards of our taxpayer dollars here.
That
in
attracts
Pickens
more
County.
funders.
That's right. That's right. And so I think there are some ways, like that Regional Grantors Collaborative is a pretty small group, and there's opportunity there to reach out to other foundations. And I do think philanthropy is going to be a place we're going to need to lean on through the next few years, and then also looking to just how we are responsibly using those dollars locally as well to really be focused on the very things that are building our social safety net here. So,
Thank you.
vague answer. That's
I would
There-
also
more
add
to
on,
come.
I think, having, if the behavioral health facilitator is approved and having that, right, that's kind of where that came from, of how to get all these different elements, all the different spaces. You get one person that's dedicated to seeing all those opportunities come through.
Yeah, I was envisioning that head count as self-funded as it was coming across our desk. So, yeah.
behavioral health is just one of the areas that we're feeling it, right? We're feeling it in some other areas right now, just core public health, food security. There's a lot of places where we're going to start feeling this tension, definitely. So I think as we lean into more partnerships, this role to me feels critical, the facilitator, to start bringing people together, because otherwise, then who? If not them, then who? I'm not sure who would. We've asked that question often. Who does bring the region together with those types of discussions, and who has the resources to do it?
Yeah. Any further questions you have for the board? Excellent. Thank you so much for your time and the report. Please thank SHG. Is it Summer as well, or someone on Summer's team? Yeah.
Yep.
Thank you.
Well presented. Thank you.
Thank you all.
Thank you.
Thank you. So we're 11 minutes ahead. We're going to skip in the agenda unless people need a break this minute. We are going to open discussion and open items, which includes a change in tomorrow's agenda, which would be moving the Redstone, which is currently number 8 on our agenda, to number 2 on our agenda,
Number 1.
to number 1 on our agenda, which would be number 2, which would be after the minutes.
Yes, sorry.
For tomorrow?
For tomorrow.
So tomorrow, just to be clear, we're moving Redstone from number 8 on the agenda, which is the emergency ordinance of the BoCC of Pitkin County, approving a development covenant for Redstone Historical Society.
Why are we moving it?
Thank you.
Rye and I both have conflicts in the afternoon, and so.
Well, I know people who are probably not going to be pulling it up to know that we've moved it. And I don't know how to get in touch with them, like Jeff Beer.
No, we've been in touch with
Okay.
Jeff Beer as well.
Thank you,
Yes.
thank you.
Yeah, absolutely.
I'm
So
like,
we've
he's
been
going
in
to get
touch.
here and he's going to be on this side. He's like, what are you talking about? Okay,
Yeah.
thanks, Jeffrey, for bringing that up.
Yep.
And that would also suit Greg, because Greg is out potentially at 4:30, so it works well for some of the board members as well as staff. So any other open discussion items? Charlotte's looking at me like she has open discussion items. Is there a possible letter that's looking for a signature?
Yes.
Which is an open discussion items?
I do have one, and maybe you all can look at it and come back to it based on your timing. You all have talked about this before, the state of Colorado's strategic growth plan is due for, any comments are due by 5 o'clock today. So we wanted to get a letter. I will share it out with you. We flagged based on, honestly, this is really based on prior board conversation and comments around when House Bill 1255 around growth management and really just focuses on kind of some of the same key themes, local control, as well as calls out concerns around 1041. So we wanted to circulate that letter for all of you to consider and to work with the chair for submitting by the deadline this afternoon. So apologies for the short notice. And I can share that as if, and you all can come back to it at the end of the day.
Do you have it in hard
Yeah,
copy?
yeah.
So I would just, for the public, reemphasize concerns around 1041, sprawl, water, TDRs.
Thank you.
And for some reason, even though it seems to be, the market scan seems to be informed by the state demographer and looks at growth rates, it actually doesn't look at all at the aging population, and I don't think anyone's really picked up on that. So it's totally focused on the governor's obsession with growth and not on really the changing dynamics of Colorado. So Kelly. And I assume you have a digital copy in front of you, Kelly.
I do. I'm just opening it, so I haven't had a chance. And I just would say that, this deadline is a little bit arbitrary. This is a deadline to go to DOLA relative to any changes they might make for their obligation to submit this report to the legislature by the end of the month. We can always write to the legislature with all of our complaints and concerns about what's in this report at any point in time. So I'm fine to submit this, recognizing I don't think it's comprehensive, and we haven't had a full chance to sort of digest and inform our comprehensive comments, and also request that we reserve and retain our right to write directly to the legislature who is getting this report, our thoughts on it.
So Kelly,
I'm unconvinced that what we submit is gonna manifest in any changes and edits by DOLA.
Kelly, would it, and correct me, would it make more sense to send it to CCI for inclusion in their letter that goes to DOLA today rather than just be a standalone county? Or
I think we can do both. I mean, I don't know I'd be more concerned about what CCI's letter might say. It might not share our sentiments in some ways. So I think we have historically been more agreeable to efforts that promote energy development, renewable energy development and things like, housing and things like that in appropriate ways than CCI might be. So having that looked at their letter. I wouldn't necessarily hitch our wagon to their letter, but I'm just saying it's okay to submit this one now and then follow up if we have sort of further detail that we want to raise by the end of the month or in the coming months even.
Yeah,
Agreed.
I would say it's missing at least 4 or 5 subjects that I would think are critical to Pitkin County that we will want to raise, and I'm happy to raise them at a future date.
Yeah, and
Can
I'm
you
not, you
wanna
know,
list
I
them
don't-
right
we
now
didn't
and we
sort
can
of
discuss it?
we haven't had a collective conversation
Yeah.
about all this. You know, I think the water sections are like super just oblivious to the reality of water, to our economies on the West Slope. You know, there's a lot that could be improved with it. Again, I think we should submit this because, you know, it's following the deadline, adhering to sort of their imposed statutes and or their imposed deadlines in a professional way, but nothing precludes us from being able to continue raising further detailed concerns in the near future.
And if I'm hearing correctly, maybe an addition that we can add is Kelly, to what you're speaking to, is Pitkin County will, be sharing more comprehensive thoughts as the final drafts are coming forward and sharing that with legislature and the state.
This is not the last time you're gonna hear from us.
Yes, exactly.
I don't have a problem with that, and again, in submitting letters, it would be great to add all the points, but chances of them reading a letter that's this succinct and compact is much greater than if you send them a novel at the beginning, they're not gonna get through it. So I think those are discussions, Jeffrey, that you agreed, and I think we all agree that let's see how things start to unfold, and then start lining up our ducks to do something that has strong bullet points, but, you know, if you make it too long, it just gets stuck in the stack. Pick our priorities.
Anything further on the strategic growth scan?
The market scan, you mean?
We were also asked by by marketing development. What do you guys call yourselves? Rosa.
Community relations?
Yeah.
So our vision for 2050 includes meetings today at the Aspen Downtown Firehouse Station at 3 to 4:30. Wednesday at the Carbondale 3rd Street Center from 4 to 6:30. The Basalt Library on October 9th from 4 to 6 p.m. and Snowmass Village Town Hall Council Chambers on October 16th from 4 to 6 p.m. Please come and share your ideals for what you would like your community to look like in 25 years, over the next 25 years. Thank you. Sponsored by the Pitkin County Vision 2050. Anything else?
I do not have any other open discussion items.
John or Charlotte? So we're going to stand and recess on break.
I
Oh,
have
sorry,
mine.
Patty.
Yes, as you know, when we had our retreat at ACES, we were supposed to receive a copy of our working agreements. I thought we had a time frame. We wanted to flip those back around, which,
And John's going to approach so we can all hear him. Because that's what Andorra's going to. Thank you.
Yes, so we have received comments from everyone,
Yay.
and I am now the bottleneck reviewing a document that
but at least
Melissa
if you
put
have them,
together.
we can blame you. Thank you, I appreciate
Yes,
the
I am
board turning
the
around.
bottleneck at this point. Yeah.
It took a while to get them so we could read them, so I'm glad we did. Thank you. That's good to hear.
Kelly or Greg, any other open discussion items? Otherwise, we will go on break until 3:15 for 2 citizen interviews.
Is it 3:50?
I'm good to take a break.
So Grassroots, we are on break until 3:15 for 2 citizen interviews. Welcome back. This is
I think we should have an opportunity to meet this young man.
I agree, but I think you have to
Hey, Ryan.
change.
We started about a minute ago, so
Sorry.
Oh, it was my fault. It was my fault. I was chit-chatting.
sorry. For those of you online, there's just chaos. It's Tuesday. It's the BoCC work
So we've
session.
got everybody
We
here.
have 2 citizen board interviews. One is via the workplace, and the other one is via face-to-face. So online, we have Christy Ferrer,
Yes, hi.
and she might be on the other coast, judging from the lights in the background.
Yeah, I'm on the East Coast.
And you are interviewing for the Airport Advisory Board. I will turn it over to Charlotte for an introduction in terms of the makeup of this board and the sense of urgency around this position.
So we do have, as you all know, Valerie Braun gave up her position, her regular position, so the 2 alternates were moved accordingly. Jim Light is now number 1. Jim Light is now taking Valerie's position, and then Ann moved up to alternate number 1. So we have been advertising for the alternate number 2 position. And Christy has applied, and she's with us today. We also have another interview for the same position. And then we've also got one scheduled on the 21st of October, Jack Cohen, and then I also received another application today, so I'm getting that scheduled.
Excellent.
So
And
that's,
so this is for alternate number 2.
it is, for
Excellent.
the Airport Advisory Board.
Thank you. And Christy, we generally would welcome an introduction by yourself, and then if you have some time, we'll take some board questions of you.
Okay, sure. I'm a native St. Louis person and been coming to Aspen since the 70s. I went to the University of Colorado. I've had a home there myself since 2002. My family's had one since the 70s, and I moved to Aspen 2 years ago. And I feel any community I'm in, I like to do service. I've been fully engaged in civic service here in New York City. I'm on the board of the Javits Center. I was head of the 9/11 Memorial, and now I'm on the board. I'm also on the boards of several other organizations in New York. The Aspen Art Museum, I just went off that board, but I'm in their National Council, the Society of Fellows. So I like being active in Aspen. I also have done some underwriting of the Aspen Fire Department and hosted the firemen when they came here, the volunteer firemen when they came to New York last spring. So I just feel as long as the price of living on this earth is giving back through civic engagement. So when I saw this position, I thought this was kind of interesting because I also served for 6 years in New York City on the Port Authority of New York and New Jersey is the institution that runs the airports, the bridges, the tunnels, and the ports in New York. So I'm not a stranger to transportation issues. So I thought that and I have a master's in city planning. So I thought that perhaps some of my knowledge and experience in these areas could be helpful or not. I mean, that we're a much smaller airport. But I know, my brain works in a way where, it's the most good for the largest number of people and trying to solve their transportation issues. So that's what interested me in this position.
And Ladue or St. Louis?
Well, Ladue is in the county of St. Louis.
I sit corrected.
That's okay. That's okay.
Patty has
What do
questions.
you do? Can I have a question? What do you do as an alternate? Wait for someone to die? No, what do you do? I don't know. I didn't know what that meant.
Well, an alternate is a non-voting member.
Okay.
I'm sorry, Ryan.
You got it.
And so you'll attend meetings, and if there is a regular absent, then you would vote in their place.
But however,
Okay.
you can participate though.
Yeah,
You are a
and-
participant, right?
You can participate in the discussions, yes.
Can I ask a question? This is a question for Charlotte. Christy, thank you for applying, first of all, but for Charlotte and Ryan, this is an alternate to the advisory board. Now, are the subcommittees that are being created going to be pulled from this group, or that's a separate group of people?
They're
Is that
already
right? Or
appointed.
they're already
Separate group.
appointed and done, is that correct? Thanks, just trying to figure out, we've got a multimodal task force, we've got the terminal task force, or whatever they're called, terminal design.
You got it.
But those are separate organizations now.
That's right. There's many layers deep at this point. So, so you have the AAB, and then the AAB ultimately recommended those folks that are now on these two task forces to you all, which have been ratified. And so those are those task forces are completely separate from the AAB themselves. That being said, the co-chairs of those two task forces are AAB members.
Right.
So there is a nexus.
So they're
there.
advisory to the AAB.
That's right. That's right.
Thank, just to make sure we understand that. Thank you.
Yeah.
I appreciate it. Go ahead.
Yeah, my question was, hi, thank you, it's nice to meet you.
Hi.
This is Patty Clapper. Time commitment, you meet once a month on the third Thursday, from 4 to 6, I believe, at the Airport Operations Center. You can zoom into those meetings also, is my understanding, so I know you travel a lot, you're a busy lady, so I just want to make sure that your schedule would allow you to participate as fully as possible, because we have so much going on at the airport. We need as much help as we can get in making decisions.
No, of course, yeah.
Okay, great. That's my question. So thank you. And thank you for being here with us today from the other side of the country.
Okay, I'll ask another one. So I guess the question is, how much time do you spend in Aspen? And how often are you passing through the airport? And which part of the airport do you come through?
Well, I actually live at the airport.
I thought you might, from your resume, yeah.
No. I spend 4 to 5 months in Aspen a year, and I go through the airport all the time. When I'm, I would say 10 times a year.
Copy that. Yeah.
At least 10 times a year, I would think. Yeah.
Are you familiar with the FBO operation as well as the commercial operation out there?
Yes, I am.
Okay, thank you. Well, your resume is fascinating, and clearly you're somebody who gets involved, and I appreciate it. What you said about service is so important, and thank you for applying. I don't have any other questions right now, but I'll wait to hear what other people ask.
Kelly for Christy.
Hi, Christy. Kelly McNicholas. Very nice to see you.
Kelly.
I'm curious as to what we're embarking on this modernization program, what your hopes would be for our future airport.
Well, to be able to accommodate perhaps larger planes that the general public can use. And I mean, I know there has been this controversy between private versus commercial, and I don't know how you guys are balancing that out, what your vision is. And I think, again, the most good for the greatest number of people is kind of the way I've often been taught to see things. And we just need vast improvements. I'm a single woman, so can you imagine when I get into that airport, I land, and I have huge bags, right? So have you ever tried to leave the bags there while you go to the parking lot to get your car? I mean, all that kind of stuff has to be smoothed up a little bit, And I think, it is quite clear that progress is going to be made somehow in all departments, whether it is arrivals, departures, air traffic, whatever.
Great, I appreciate it. And yeah, I've lugged car seat bags and strollers with kids. You can't leave.
Oh my God, no, I mean, it's unbelievable. Also, I should say one thing, because I worked with Mike Bloomberg for 12 years, I was his liaison for the 9/11 families. They started an organization called Bloomberg Cities. I don't know whether you all are aware of that. So for $1 a year, Paris, Texas, or Paris, France, gets the Bloomberg team that he had while he was mayor to help them with their problems, whether a village or a small city or whatever. And I would love to be able to see if those resources were could go to work for us in some way. I actually, when Tori was around, he was my tennis pro. So I said, put Tori in touch with the Bloomberg City people. I don't know whatever happened. But anyway, I see good resources for us in that organization. Just saying.
Christy, what would be your number one sort of takeaway from sort of Port Authority life? Like, what's the number one lesson or sort of reckoning that you would say you took away from that experience? Doesn't necessarily have to apply here, but just sort of biggest takeaway, I guess.
Politics.
Yeah.
I hate to say, politics. You're appointed by the governor, and 6 from New York and 6 from New Jersey, and you have to keep not just the greater good in mind, but also how you're going to get there in a practical sense. Mm-hmm. And also just collaboration, key collaboration, not with the other commissioners, but the people who worked at the port, who were so dedicated. I don't know whether you know anything about the New York Port Authority, but they have a funny name for it. They call it Mother Ponya, which is the initials of it, because it's always taken care for many, many decades, almost a century, all the people who work for it. So they're all very loyal and dedicated. And it's really knowing as a commissioner who, how to use that staff appropriately and collaborate.
I appreciate that answer. Follow-up questions?
Well, Christy, yeah, thank you again. You know, we have so many, you know, we've got a big, it's a Gordian knot is the word I used earlier, and that came back to mind with our entrance to Aspen and the transportation, the multimodal solutions we're trying to find with resource efficiency, trying to deal with congestion with the commuter on our commuter corridor, new massive housing developments coming in right on the highway, adding stoplights, the airport reconstruction, you name it. We have got this incredibly complex problem that would challenge even an airport authority person, I'd say. So I just looked up the Bloomberg Cities. I think it looks great. Thank you for that. But I think if you dig deep enough, you'll find plenty of challenges here.
Yeah, I'm sure. I used to dream that I could help the housing problem, the employee housing problem. And I talked to some developers in Aspen who I know well and say, you know, how can you not find somewhere where this can go, you know? And it's the opportunities that have been passed up by the city of Aspen. I don't want to get into that, but I'm just saying, there's so much opportunity to do good things here.
I hope we have more opportunity to talk to you about that. Come see us when you're back in town.
Well, if I'm not chosen for this place, you tell me where you think I could best serve.
Thank you for that.
Aspen, and after using Aspen all these years, it's time that I gave back somewhere.
Well, I look forward to that conversation. Thank you. And yeah, we will keep you in mind. No question.
Christy and Charlotte, thank you.
Thanks, Christy.
Thanks, Christy.
Travel
We'll be in
Bye
touch.
now. Good to meet y'all.
You're missing
Bye.
fall colors. She's gone.
Okay.
All right.
Welcoming
Central Park looks nice right now too.
welcoming to the dais is Laura Whitley.
Hey, Laura.
The bouncy chair. Hi, y'all. How are you doing, commissioners?
Thanks for coming.
Fantastic.
Thank you.
So I'm going to start by introducing and thanking you, because I think you're an active participant in this crazy community, and you've also been instructive to this board. So thank you for all of your comments.
Oh, you're welcome.
Whether that was Biole or solar fields, I know you're actively engaged in the community, so I wanted to lead with that. And then, am I going to go back to Charlotte or go directly to?
She's here for the same position, so I don't think there's any need to.
But we'll leave the floor with you then.
Okay, to introduce myself.
Yeah.
Yes.
Or tell a story, or something we don't know.
I have been in Aspen as a resident and a worker and a mom and an artist since 1998. And in terms of experience and perspectives, I have almost all those years in public service, most recently with the city of Aspen, where I head up the public art program, but for all the years before that working in nonprofits. And that's in education, that's in the arts, and that is 5 years spent at CORE. So I feel like I have a great background in public service, climate. As an artist and as an entrepreneur, I had a small business where I was a consultant in creative strategy and strategic communications. And I might have a little bit of experience that you haven't seen come through here before, which is I worked for 3.5 years for SkyWest as a ramp agent at the airport. So I've literally been in the bowels of the airplanes and the terminal. Not telling any secrets.
Back rooms.
Like, what happens there stays there?
Yeah, exactly. So my goal, if I were to be selective, is really to help to create an airport that we can all be proud of, that's based on local character, culture, and history, straight out of the Common Ground recommendations.
Thank you for that.
So my question, what haven't you done or participated in the community? So your children came with you in 98?
Oh, no.
Oh.
They arrived here on their own.
Really young. So went to school here and went through the system
Yes,
here?
they did. And they're in college now, so I have a little more free time than I have had in the past. And in May, I had the opportunity to attend the Colorado Creative Industry Summit. They're a part of the OEDIT. And I went to a fascinating panel with 3 mayors of mountain towns, Ridgway, Breck, and GJ. And what they were talking about is the unique set of skills that artists have in project management, creative strategy, collaboration, out-of-the-box solutions, budget stewardship, that uniquely qualifies them to help solve some of the complex civil and community issues. And what we need to do is be getting more artists at the table. And I thought, okay, I heard the call. I'm going to step up and bring some of those skills plus my community experience in climate and at the airport to bear if I'm selected.
Did you have anything to do with painting at the gas station?
No, I didn't.
I love it.
I love it too. We have public art is really blooming right now.
Yeah,
and
I love it. When I was watching, I'm like, what are they doing there? And it just evolved. And it's pretty cool when you walk that direction. You just it's there. It's pretty cool. It's very.
Yes, and I think we have a great opportunity at the airport for public art. Right now, the public art we see are digital ads for real estate agents.
Well, we need those to help fund the airport, so keep that in mind.
Okay.
Public art is for sale there, and it's part of our revenue base. Yeah, we're going to have more space, and I have some ideas about historic for the terminal. Has to do with mammoths from snowmass, which are actually from unincorporated Pitkin County. I'm putting a plug in for Pitkin County there. But it's so nice to have you here. We run into each other here and there all the time, I think.
I know.
Yeah.
You have some questions for me? I'm ready.
I do. I want to go back to the experience, sort of the back of house. So a lot of the conversations with the architects, with mechanical engineers, is sort of front of house. And as a newly elected, I got to tour back of house and see the sort of space heaters and the environments that we've subjected people to in interesting environments. So I guess I'd welcome your insight outside of the common grounds, just sort of what stands out to you that needs to be addressed, if you will, as we sit with the architects and the engineers over the next couple of years with respect to, again, sort of lean on your SkyWest employment for a minute?
Sure. Well, the first thing I'll say, and that I was really happy to discover this, is once I saw how the sausage was made, it's being made very safely.
Yeah.
Safety being number one is real.
Yeah.
And the team there takes it very seriously from the top to the bottom. And I would fly in and out of Aspen anytime.
Thank you.
The second thing I'd say is we're not making it any easier for our airport workers to do their job. It is substandard.
Mm-hmm.
You know, we didn't even have a place to wash our hands in the break room. So, and that's just one tiny thing, but it's overcrowded and equipment in need of replacement, and, you know, the team got it done, but they were doing it just, I would say, despite the terminal, not because of it.
Yeah. I think if you have a chance, and some of the folks on this board, and I don't know if Ryan's still in the room,
He said he had to go to a meeting.
We did have an opportunity as a board and staff and the design team, both the local architects and our Portland architects, to tour PDX, to tour Portland, and front of house and back of house. And it was exceptional. And I think, to your point, sort of those moments when you're stressed, or those moments where we should be taking care of people, whether that's directionality, wayfinding, security, seem to be really well addressed through this design team. So I think your input, having worked on one part of the house, would be advantageous to this board. So thank you for applying. Questions for Laura?
Sure, I'll go. And Kelly, do you want to jump in, or do you want me to go?
You can go, and then I'll go next.
Okay, great. Yeah, thanks. Laura, it's great to hear about your back of the house experience. I guess I remembered seeing you there, but I had to be reminded. So that is really valuable, and you confirm all of our, the concerns we've had, and the need to do some innovation with this airport. When that airport was built, it was the bleeding edge. It was something we were all incredibly proud of. A leading architect who was deeply involved in energy efficiency and renewable energy and all the stuff circa 1980, whatever it was, 84, was involved in that. And we had an airport that really worked for us at the time. It doesn't any longer. Pretty clear that as much as we love things about the terminal, and we love things when they don't change. But in this case, it needs to change. It really desperately needs to change with the TSA requirements and all the other requirements, just the volume of people traveling through. So thinking back to the vision they had back then and the innovation that they brought to it, I'd love to hear a little bit more just about what would be your vision for this airport and why.
Mm-hmm.
That's a great question. I'm not here to pretend that I am an expert in all things airport. And I think what's really amazing is the number of community members that you have had step up for the Joint Task Force and for the AAB, and their collective wisdom and expertise that they bring to the table. And also the architects that you've hired. So the bench is very deep. Mm-hmm. And I'm also not looking to create anything outside of the CGR. I think the vision is there already. I think what needs to happen is for people to bring creative thinking and strategies and a collaborative attitude and local knowledge to the decision making, to the advising and the recommendations. So I don't know if that feels like a dodge.
Not at all.
But it's respect for the process that's in place, and then participating fully in it.
That's good. It's not a dodge. It was a very good answer. I also know that you're a dreamer and you're an artist and you do fantastic things. Would you be bringing any of that to this conversation?
100%. So one of the first things that I wanted to learn when I received was the opportunity to work for the city on what is the first public art program is I wanted to know the history of public art in Aspen. And a lot of us think that it started in the 1950s with Bayer. However, Aspen and art have been completely enmeshed since 1889, when the Wheeler Opera House was founded as a cultural destination and place for our community to gather. In 1893, the first piece of public art happened in Aspen. It was commissioned by the townsfolk of Aspen. It was the Silver Queen statue that went to the 1893 Chicago World's Fair. And so we are art, just as we are mining and we are ranching and we are skiing and we are tourism. It's been there the whole time in our DNA. So I hope that we have a world-class airport that will reflect that as part of the culture and character of our place.
Well said, thank you.
Kelly.
Hi, Kelly.
Thank you. Hey, Laura, how are you?
Good, how are you?
I'm pretty good, thanks. I'm home with a sick kid today, so sorry I'm not there.
Well, thank you, working mom.
Yep. Every day's a juggle. I'm wondering, so I guess, did you apply to any of the other boards that have recently been open for the airport, any of the task force committees? I don't remember our full lists of those.
No, actually, as a SkyWest employee, I wasn't allowed to. We also couldn't speak to the media or even come and talk to y'all on any issue of import. So I was a SkyWest employee till March, and then I was an in-the-weeds, deer-in-the-headlights new employee at the city in our first season, and so I wasn't aware of the task force application in July. So I missed that. So this is my first, this would be my first board application, but not the first civic engagement I've had. I have been a longtime volunteer for various local organizations, and I also attended AAB open houses as I could. I wrote letters under a nom de plume since I wasn't allowed to communicate as a SkyWest employee, and I also attended the Joint Task Force meeting last week. So that's how I've been involved so far.
Okay, that's great, thanks. Yeah, because I guess I was wondering, some of the stuff that the AAB does is not particularly glamorous. If you would be interested in that, dealing with flight paths and noise, or what do we call the geographies of the noise cones and, safety policies and lease agreements and, real kind of wonky stuff. So I guess I just wanted to check in about your interest and understanding of like the breadth of the scope of work. That sure, a lot of it is focused on the modernization of the airport, but not all of it.
Sure. I feel like at the airport, I got a PhD in not glamorous work. So you have to just show up and do everything that needs to be done when you're a shift worker at the airport. Working in production, whether it's for art or any other kind of nonprofit, sometimes those look glam. It's just roll up your sleeves, hard work, get it done. It's about logistics and understanding who your audience is and understanding what the task is at hand. So I'm not afraid of learning. I consider myself a lifelong learner. I'm not afraid of rolling up my sleeves. And I am somebody who's just curious by nature. So that doesn't deter me. And my background, 5 years at CORE doing science communication when I was not a scientist, means I had to wade into a lot of deep, wonky stuff and actually try to translate it to the community. So yeah, I think I'm up for it.
That's great. Thank you.
Thank you.
Especially the wonky part. It gets a little wonky out there sometimes, right, John?
Laura, what do you think the biggest community fear is right now in terms of airport and airport redevelopment?
I think it's having something done to us.
Thank you. Final round? Lightning round?
You know, we just had a big discussion about behavioral health, and we do have to question people's behavioral health when the airport right now, we have so much going on. Talk about fun and exciting and a little crazy. It's a great project we have moving forward, and from what I've read about you and what I know about you, I don't know, I think maybe you have what it takes to take that on.
Thank you.
Yes.
I'm not sure I know what behavioral health is, but
Yes, it was a polite way of saying we evaluate people's mental health status when they
I
apply for
passed.
the airport.
The initial
advisory
round,
board.
right.
And I guess I set this up at the intro, and I'll provide it at the outro, which is I really do appreciate when you come in with your letters. They're really well thought out, whether that's Bayou Retreat and your either testimony in person or your letters. And I want to say, going back to the solar fields, I'm pretty sure you were part of the team in support. So I really appreciate your community support and community input for many years.
Thank you very much. I enjoy writing and I enjoy thinking about things and making connections. So I'm glad that got through.
Yeah, thank you. Greg, with the final.
Favorite architect?
Whoa.
Favorite architect?
ZGF.
Yeah, that's who I should say.
Frankfurt, right?
So if you had to choose between Lorenzo Piano, Salvador Dali, Antonio Gaudi, and Frank Gehry, and and someone like that, Maya Lin, who would you choose?
Oh, well, that's kind of a hard.
Of course,
I have
trying
no
to throw you
idea.
hard questions.
Okay. I was really fortunate to see Maya Lin speak at the design conference this summer and was pretty much blown away by her humility. And I think that is a fantastic quality because she is the master of her work. A deep understanding of sight and place and blending in, and almost by not standing out more. And I lived in Barcelona for a year when I was younger, and I have to say Antoni Gaudi's organic forms are really seductive, and I loved his process and his long-term thinking. The Sagrada Familia, he knew it was going to be built for centuries after he was gone, and so that's a kind of thinking we don't really have the luxury of in such a young country. So I'm going for 2.
Are you suggesting that we should take our time building this airport?
We have taken our time. Our time is up.
No comment.
Laura, I will admit, probably one of my favorite architectural books is Maya Lin's Boundaries. So you could say it's an art book, but it's...
Yeah, she does both.
Yeah.
In fact, both of those architects and many do both. Yeah.
Thanks. Thank you.
All right. Thank you very much for your time.
Likewise.
Thank you all.
Thank you.
Thanks,
So-
Charlotte.
Thanks, Charlotte. Good to see you.
Future agendas are done.
If there is nothing further, Kelly, we are going to adjourn for the day.
Do we have any more open discussion from anybody? I don't know if anything came up in the interim, John. Nothing came up? Tomorrow noon, right?
Tomorrow, Wednesday, October 8th, again, we will start at noon. And for those that are online, we will, again, move the Redstone Historical Society, which is number 8, to number 2, which is after the minutes, tomorrow, Wednesday, October 8th.
Great.
This meeting is concluded.
Thank you.
Thank you.
Thanks very much. Good job.
Thank you.
See you then. Thank you.